CareBridge decided to pursue the accreditation in virtual care because we are a quality-based organization and we partner with health plans. We know that they value the importance of quality, and so do we. And we're a 100% virtual organization, so we felt like this was a perfect fit for the work that we do, and we wanted to take the opportunity to both look internally to see how we are doing from a quality perspective, process perspective, as well as make sure it aligned with what the industry felt like was important. I think our biggest surprise was that we were doing a lot of things right. So we did not have to build a ton of new processes to prove the outcomes and to respond to the standards that NCQA had put together. Things that we had already thought of that we just had to either fine tune or put more rigor to how we evaluated that a process was working. So I think the standard we thought, or the standards kind of as a category we thought were going to be the hardest were the ones around data. We're all worried that have you collected it the right way, that you can actually report on it in a measurable way. That ended up being not the hardest. I think all the things that you guys asked from like a data perspective were things that we were collecting. But the thing that ended up being the hardest was one that surprised us because we just didn't really connect it with the work that we do, was around the digital health literacy. So the whole concept around how do our patients use information that they gain from the internet, and how do they know that they're using a trusted resource and things like that. So what I would share with any organization who's considering virtual care accreditation is first make sure you're not on an island within your organization. You can't do it alone. So make sure the whole organization, obviously it's good to have a champion, but that there's folks who can get on board from other parts of the company to do it as a team. Build that team, look at the standards and that NCQA provides, and even if you don't have all of the things put together, the process of having the teams work together to think through the standards and think through how you might change or modify existing processes to meet the NCQA standard or to become a better quality organization is super worth it. I mean, there's still things that even this interim period between the pilot and seeking the full accreditation, there's been a lot of these processes that have really reaped benefits for how we make sure we're giving excellent care to our patients. NCQA is very respected across the healthcare continuum, and so that was one of the other reasons why we wanted to pursue NCQA accreditation. There was no other accreditation stamp that really fit for an organization like us who was 100% virtual. We don't really fit in the PCMH bucket, or we're not doing delegated credentialing. But we know that it's valuable to have kind of the NCQA stamp of approval as you're an organization kind of proving that you're committed to quality, and so this was the one that fit well for us.